Hi everyone, my name is Jade Amaya, and the topic that I'll be going over today is the impact of socioeconomic status and the healthcare system on the infant and maternal mortality rates in the United States. Um, so for this project, the main question is how do healthcare systems and socioeconomic status contribute to the infant and maternal mortality rates? Socioeconomic status being your social status as well as your economic status. So this includes race and income. So why this project? A person in my family who's really close to me experienced a miscarriage and the doctors didn't tell her anything. So it kind of made me wonder about what goes on behind the scenes in the healthcare system and whether miscarriages can be prevented or can stop happening in the future at high rates. So here's a little healthcare system overview. I compared the United States to four other developed countries with universal healthcare system because the United States has a mixed economy system. So basically that means that it's comprised of private and public insurance. And while these four other countries with the universal healthcare system also have private insurance, everyone, regardless of race or income, has access to public health insurance. So I'll give you guys just like a few seconds to read a brief overview. Due to time constraints, I won't be able to go over all of it, but here's like the main key points. Okay, so I'm going to go ahead and move on to the next slide. And for this one, it's talking about the infant and maternal mortality rates. And I pulled the data from the World Bank website, which basically has all the infant and maternal mortality rates for each country. The five that I chose were the United States, Canada, United Kingdom, Japan, and Norway, just because, like I said, they're developed countries, and I don't think it would be fair to compare apples to oranges. So I wanted to keep it like apples to apples. And higher IMRs, which are infant mortality rates, typically indicate lower quality healthcare systems, just because you do see more infants or babies dying at higher rates, while lower infant mortality rates typically indicate a higher quality healthcare system because there are more care attended to mothers and babies. So for this graph, I created it using Google Sheets, and this is basically 1,000 live births. Just because of population differences, it had to be proportional. So as we can see, the United States has higher infant mortality rates compared to the other ones, and they're labeled at the top. And for the maternal mortality rates, it was a little bit harder to find data for this one. And so I just compared it to the most recent one in 2017. And it's measured at 100,000 live births. So for every 100,000 mothers, these are the rates at which, unfortunately, some died while giving birth. And a point that appeared during my research was maybe it's because mothers are older or younger in countries. However, the average maternal age across the board for all these five countries is 30 years old. So that was a factor that was ruled out just because as mothers get older, it does become harder to have children. So natal care was also another factor that I considered under the healthcare system, just because it's extremely important that mothers receive care during their pregnancies. And typically women who didn't receive prenatal care had greater rates of preterm birth, which is having birth like before your expected due date. And then also this influence like ectopic pregnancies, and then minority groups were at higher risk of pregnancy or health complications. Um, Compared to the majority of the population in the United States. And socioeconomic status. So in the United States, people with lower socioeconomic status face more adversity just because they can't really afford that private health insurance, which across all five countries, those with private health insurance had more access to benefits that weren't provided by a public health insurance. So and a cool thing that I also found was a cross-sectional study in Norway where researchers found little to no systematic discrepancies in economic barriers. So my conclusion was basically that public health policies, or sorry, that we should have public health policies to improve natal care access for mothers, to improve that public health care to mothers so it could lower the infant and maternal mortality. So thank you. That concludes my presentation. And I do want to give a shout out to my mentor, Haley, who majored in public health. Any questions?
Great. Thanks, Jade. We have a few questions. How has COVID's stress on the healthcare system impacted IMRs? Do countries that handled the pandemic better have better IMRs?
Yeah, so that's a great question. I wanted to keep it before COVID because obviously COVID did influence the healthcare system just because there was a lot more hospitals filled with COVID patients. So I don't have the data pulled right now, but I can imagine that there might have been a slight increase in the rates, even if it wasn't as significant, just because mothers weren't allowed to go in as much due to COVID and the shutdown and everything. So I would definitely say that pandemics could have an influence on the rates. Um, but that is something that I want to dive more deeper into just to kind of like compare like before and after COVID.
Great. And then did you evaluate differences in race in maternal health care as well?
Yes, I did. So in the United States and probably Canada too, because it's more diverse in terms of like different races, there were differences in regarding the treatment that they received. So in the United States, read about studies that if you had like a darker skin complexion, or if you were like Hispanic or African American, you weren't given as much priority or care compared to white mother patients. So,
And then what was one of the most unexpected things you learned in your research?
um, I would say um, the percentages of private health insurance in other universal healthcare systems. So I thought like, oh, maybe because they have universal healthcare, there would be like no need for private insurance. However, a lot of these private insurance were offering benefits that weren't really covered under public health care. So like dental insurance or like maybe eye insurance and stuff like that. So I thought that was really interesting.
Great. And the last question is, what advice would you give to another student just starting research on this topic?
I would say definitely try to learn statistics and also try to read a little bit more about different healthcares, just because not every healthcare is the same. And although there might be similarities, um, there are still going to be a lot of differences. And then try to like see like, okay, like what's working, what's not working. And a background in statistics will help a lot with like understanding the data and stuff like that.
Absolutely. Thank you so much, Jade.